Hello, I'm Phil Jones and I am with the health team at Audit Wales. Today I'm going to be in conversation with Claire Smith and Nicola Bevan. We're going to be talking about health and wellbeing in the NHS during the pandemic.
Hi, I'm Nikki Bevan. I'm Head of Employee Health and Wellbeing Services in Cardiff and Vale University Health Board.
Claire Smith, Head of Workforce Programmes at Health Education and Improvement Wales.
Okay. It would be really helpful to hear something about the work that you've been doing for some time as part of the Health and Wellbeing Resources Project. So that's perhaps something about how it came about and how it's been progressing, particularly given the pandemic situation that we've been facing for the last year or so. Open the floor to you both.
The Health and Wellbeing Network was established in the summer of 2016, and it was a colleague of mine, James Moore, who was based in Welsh Ambulance Service Trust at the time, had the idea of developing a network. So we invited all the heads of employee wellbeing services, occupational health, and anybody with a responsibility within the health boards and trusts to join us on the network and to see how we could work together collectively, where we could share best practice and where it made sense, develop Once for Wales products. So we've been running now over 5 years, and we've created a place where people want to come. And in a lot of instances, these people were lone workers within their organisation, and it was important for us, especially for James's idea, was to establish a group of people who wanted to come together and work together to develop health and wellbeing resources for NHS Wales staff. So that's how it began. There are 3 national groups. There's a Managing Attendance at Work project group, and an Occupational Health project group, and a Health and Wellbeing Network. And my colleague Nikki Bevan sits on all 3 groups with me, so it's lovely to have her here today. Then back in the beginning of COVID last year, there was a call to try and get all these resources into one place. So what we developed in HAW, we used the technology that we just acquired to develop a playlist. So the leadership team within HAW helped to build that. And basically what it is, first and foremost, is a central repository of health and wellbeing resources. And right at the top of that playlist was the links to all the health boards and trusts' internet or intranet sites, so that staff could access directly into the resources for their local organisation. So back in April time, the workforce cell for COVID-19 was established through Welsh Government, and the health and wellbeing subgroup was established to report into the workforce cell. And on that group, we had representatives from Welsh Government, from Social Care Wales, trade unions, and the health boards and trusts in Wales. And that continued to run. We met weekly and we worked at pace in the early weeks, and it continued to run probably until about September, and then the work transitioned back into the Health and Wellbeing Network.
Claire, I'm just wondering, you mentioned about quite a wide range of people who came together at the beginning of the pandemic to form that group. How much did you benefit from already having a pre-existing network?
I think there were very different groups to begin with, but I think what helped was that some of the members already had a strong working relationship together and were able to draw upon the resources that they already had in place. So that was quite beneficial. I think as well that what was beneficial about the new group was we widened the stakeholders. So before it had been very much sitting within NHS Wales, Whereas all of a sudden, the health and wellbeing cell for COVID had expanded to bring in our social care colleagues, Welsh Government, trade unions. So that the expansion of that gave us a whole different sort of perspective in regards to the health and wellbeing of public sector workers, really, and carers. So that was really beneficial as well. The group that Claire was talking about in regards that set up in 2016, I think personally I have found it a great source of support, because I think having that network of like-minded colleagues who it's just been, you go in and you're able to share really difficult situations that you've got or ideas that you want to sort of take forward, and you've got the support of like-minded people as well, which has been really, really helpful for me personally. I think it's also a psychologically safe environment as well, and that's taken time to develop. It's through time of getting to know your colleagues and feeling that you can trust them has given us an opportunity to seek support when we need it as well, because even though we're health and wellbeing practitioners, we still need that same support as anyone else does. So having that sort of all Wales approach has just been hugely beneficial.
Does that translate locally as well? Thinking about how these services have responded to the pandemic over the months. Obviously, they're not doing that alone, and the value of their own networks on the local level presumably is important.
I've benefited from having both the national cell, which was developed specifically for COVID, and also from the pre-existing health and wellbeing group during COVID, because it's allowed me to benchmark. It's allowed me to take some of the ideas that had already been tried and tested in other health boards and utilise them in my own health board, which is Cardiff and Vale University Health Board. I think the COVID cell as well, we had experts in that group that were able to bring their expertise and their knowledge, so that we knew that, one of the things that happened in the early stages of COVID was there was an avalanche of information that was coming in, offers of support, there was information, there was posters, there was ideas, and you were overwhelmed. I mean, Claire was actually the gatekeeper for that. And, I can't imagine how she dealt with it, because she actually sifted through first of all, and then sort of passed on for the COVID cell to approve or validate rather. And I think what was great about that was we made sure that the information that was going out on an all Wales basis had actually been, as I say, validated and was deemed appropriate for the needs of our colleagues, because there was just too much information and staff couldn't process it. I couldn't process it. It was just too much. So both groups have been hugely beneficial throughout the COVID pandemic so far.
Nikki's got a good point there. One of the things that we did was we developed a quality governance framework. A colleague, Dr. Adrian Neal, who leads the Employee Wellbeing Service in Untitled Bevan, developed that framework. And basically what that does is, as Nikki mentioned, validate. It's almost like our kite mark, so that any resources that we recommend and we post on our website are assessed against this framework. And, Nikki was correct. There was so many people wanted to help. And we just needed to make sure that we had a measured approach so that we didn't overwhelm staff, because that was a message that was coming back clearly to us early on, is that the offers of help were just coming from every direction, and we needed to almost long list filter some of those, and there were some bad and there were some ugly products, but generally most of them were good, and therefore we had to make a judgment on which ones we highlighted. And what we did back in the 17 days of lockdown in September, and then the 5 days that were planned by Welsh Government that we were going to be free over Christmas, we did dedicated campaigns, communication campaigns. In fact, in the Christmas period, we did a thunderclap where every organisation communicated the same message at the same time every day, highlighting the main products. So our message has always been, this is what we recommend, and here's how you can access them.
Is that something you think you'll continue with, that kind of approach? Maybe periodically where you've got something that you particularly want to share? Just conscious that you've got your network set up there, haven't you? And
so some of the things that we're thinking about now going forward is how have the national and local health and wellbeing resources helped colleagues? And what we're doing is we're measuring access to these resources. So for resources such as Health for Health Professionals, Silver Cloud, Samaritans, we get a report on a weekly basis which tells us how much activity there's been, how many staff have accessed these resources. We also need to look at are there any barriers to accessing these resources? Do staff, are they aware of them, and what more can we do to raise the awareness of these resources? Also, we'll continue through the network to benchmark, share best practice. I'm a member and attend some national groups which has the other 4 nations attending, so I'm always horizon scanning to see, well, what is NHS England, NHS Improvement, what is Northern Ireland, what is Scotland doing to support their staff? Are there any gaps in our resources? Are there any resources out there that we really need to raise awareness of, such as things like To Wish Upon a Star, charity, Able Futures, Remploy? What is there that's free that we can take advantage of for our staff? A lot of our staff have employee assistance programs as well within their health boards, and they have employee wellbeing services in-house, which includes, some of them includes physiotherapy as well as emotional and psychological support. So are there any gaps? And what is the long-term recovery going to look like? So that's what we're concentrating on at the moment, is that how long do we think this is going to last? How long will staff need support for? Will it ever stop? And does this provide us with the opportunity and platform to really position staff health and wellbeing as a priority?
I would have to agree. I think one of the possibly unexpected outcomes of the COVID pandemic has been that wellbeing of staff has always been sort of discussed and, you know, seen as a priority, but the COVID pandemic has actually raised that to another level. It's a conversation that's been having at all areas throughout, you know, NHS Wales and probably public sector in Wales. So I think it's almost raised the profile to an even higher level about the importance. And I think, yes, we do need to plan the recovery, but we also want to, you know, in Cardiff and Vale, what we want to do is move away from that reactive sort of stance that we usually take when it comes to health and wellbeing, and get into a more preventative and proactive way of supporting wellbeing longer term. And this has almost given us a platform to do it. I think as well that one of the other things that really happened was this all Wales approach. Well, whilst we'd been doing it since 2016, developing resources that were, you know, once for Wales and all Wales tools that we developed, from a sort of a Welsh Government point of view, we suddenly had that support. So the Samaritans helpline for NHS and public sector staff it's been supported by Welsh Government. Whereas, you know, previously we would all have to go out as our health boards and negotiate or procure that separately. So I think, for me, the benefits has been we've now got these services that are all Wales. Silvercloud now is all Wales, and we're not, procuring that as individuals. It's just, a different way of working. And I think it starts to mirror the work that NHS England have been doing for their staff, whereas they have services that are in place and it is for all staff within NHS England, whereas it's been very separate within NHS Wales. So I think we're starting to chip away at the way we provide services and the way we think about the needs. We still need that there will still be local differences, and we still need to take an individualised approach, because each health board will have different needs. But I think there are services that will benefit from an all Wales approach as well. So that's one thing that I'm hoping we'll be able to take forward, and the Health and Wellbeing group will help hopefully nudge that along, help sort of encourage that viewpoint. I think that's what I'm hoping for.
There are two things that I wanted to pick up, Nikki, on the back of that. One is the local stuff, which is, if it really has elevated awareness and of the necessity of providing these services, and not just to particular groups of staff, but to all staff. What will it take for organisations to be able to consolidate that learning and plan for it accordingly? And then I guess the other question is, at national level, is there anything that needs to be developed there in terms of policy direction that will help support and drive those kinds of changes?
I think organisations are probably doing their own lessons learned at this moment and planning for their own direction of travel in the next few years. I do think there's a potential role for the Health and Wellbeing group to try and consolidate that and look at what all Wales initiatives we can consider. Claire and I have had a discussion recently as part of a wider group around initiatives such as one of the initiatives that came out during COVID was the free access to certain health and wellbeing apps that had been actually procured through NHS England, but it was available to any NHS staff in the UK. NHS England are now in the process of renegotiating, because it comes to the end of March. NHS England, as I say, are renegotiating that access for NHS England staff. I would like to see, how can we do that and mirror something similar in NHS Wales, where we're not going off as individual health boards, but doing it as a One Wales approach and thinking, sort of very high level what needs to be there for staff. And I do think that perhaps that's something that we do need to start thinking about is, we do want to see Silvercloud continuing. We still want to see Health for Health Professional Wales developing and being, rolled out for NHS and public sector staff. We do want, access to, some very robust, and as I keep saying, using the word validated today, but evidence-based resources that are for our NHS staff to utilise on top of the local resources that are needed as well. So I don't think anybody's had that conversation about what do we need on an all Wales basis. As I say, Claire and I had the discussion specifically about the apps that are coming to the end. And the other question about, what was how do we drive policy change? I suppose it's through us raising awareness as well. Because we have learnt lessons both nationally and locally. So I think we have an opportunity to start to drive that forward as well.
Yeah, I was going to say, Phil, we do have some key documents within Wales that are really supportive, and that's the Healthier Plan for Wales. We've got the Workforce Strategy for Health and Social Care, and we've got the Future Generations Act as well as the Health and Wellbeing, the Social Services and Wellbeing Act as well. So we've got quite a lot of policy documents within Wales that provide us with that foundation.
And in terms of the Health and Wellbeing Resources Project, is it in any part the a sort of the outcome of the project, if you like, that you would present a vision or a direction of travel nationally?
I suppose we've never been asked. As Claire said, the group was brought together by James when he had a vision about just sort of having this collaborative approach to well-being. And I'm not aware of us having a remit, or someone asking of us. We as a group, I say we, the Royal We, Claire and James, came up with it with a vision about having these resources and the tools that we've developed. And we again, the Royal We, Claire and James and the group came up with the momentum and the drive. So nobody asked us necessarily to produce this. We produced these resources as well. Would you agree, Claire, or?
Pre-COVID, yes. Yes, I think we recognised the benefits of working together, and very early on, what we did is we looked at, so what do we think will add value, and what would that look like for staff? And that's when we developed the Our Wellbeing Matters and Manager Wellbeing Matters documents. But I do think that it would be a real opportunity if the network were in a position to develop a vision and a mission and a set of objectives and an aim as to how we would like the NHS workforce to be supported. And we have all of it within the Healthier Plan. We have that main aim in the quadruple aim. It's just the process of doing it. So I think that would be a real positive way forward.
And I think we've moved beyond NHS Wales now. As I keep saying, public sector. I think the COVID work that we did expand our horizons. We've got this working with our social care colleagues, and I just think that it's more of a wider public sector vision rather than an NHS Wales, and it's having that collaborative work together, third party, or third sector rather, as well. So I think it's there's lots of good work that's come out of the COVID pandemic, and different ways of thinking and working, and just breaking down the barriers that the silos that we were in.
What kind of plans do you have for the project going forward?
Okay, so back in March, we developed a COVID-19 strategy template, which was based on the English model, Prepare, Active and Recover, and also Dr. Adrian Nadle's strategy that he developed in Smith Bevan. And that template document was made available to all the health boards for them to take and bespoke as necessary for their staff and their demographics. The plan is to do something similar again now, to have a much longer term plan for health and wellbeing. So that's in the process of being developed. And I think there are some key pieces of work that also feed into this. So, for example, we've got the work that James has been leading with the healthy working relationships and the big conversation and the measuring colleague experience, the staff survey, and also then the work that Helen Thomas has been leading on compassionate leadership, because ultimately it's the behaviours of staff, of peers, that impact directly the health and well-being of staff. How you are spoken to, listened to, treated, respected, and even as far as disciplined is so important in that preventative arena that Nikki mentioned. We need to move far quicker into a system proactive basis rather than an individual reactive. So that's the space we need to get into, and we should be doing that, as Nikki mentioned, in a public sector view, because teachers, police officers, firemen, anybody in the public sector, or even sort of supermarket workers, anybody that has to continue working, that is putting themselves at risk of COVID, these resources can help. So I do think we need to have a pan-Wales approach to how we can stop our staff becoming sick, or even just what we can do to keep them well.
How broad is the compassionate leadership work at the moment? What's the scope?
It's an all Wales programme. There are 9 principles, 9 leadership principles. It comes from the work of Professor Michael West from the King's Fund, and it's all positioned on a digital platform called Gwella, which is based in HAIW. But basically, compassionate leadership is just about listening, understanding, being helpful, being kind, and taking the time to spend with people. So some of the messages that we're trying to get across is, as managers or as colleagues, you are the best people to support staff on an everyday basis. You know, whether it's a 2-minute conversation or a 5-minute sit-down coffee, you know, and some of the things we're saying is, if you see a member of staff or a colleague that is struggling, or somebody wants to talk to you about how they're feeling, to do is just this, in simple terms: pause, breathe, listen, ask questions, be helpful, be kind. And you have it in you to do that. It's not rocket science. It is basically human nature to do those things. And I think what happens when we're in crisis mode and our stress chemicals are flooded in the brain, we're working on automatic pilot. And I think so, to keep those messages really simple, you know, if somebody needs to talk, just give them the time and listen. And ask questions, and then if you can help.
I think just to build on that, Claire, the work that Claire mentioned earlier on, there's 3 project groups, and one of those is the managing attendance group as well. So almost before, you're sort of, you know, in support of the compassionate leadership work is the All Wales Managing Attendance at Work policy, and Claire and I were both involved in that group as well, and I think that turned the managing attendance. So previously it was a sickness absence policy, and we sort of flipped that into a managing attendance, and woven through that and underpinning that is about managers knowing their staff and supporting their individual needs and listening to them. And I think that just underpins the work of the compassionate. It is about listening and talking and understanding, and that's what we want to encourage, is not just a tick box exercise that you work through. It's about, you know, listening and having sometimes open and difficult conversations, because, you know, we're never ever going to make people 100% well. People will be unwell, but it's how we support them to maximise their ability to manage their wellness and, you know, their level of well-being in the workplace. So I think it all interweaves and it all works together, and that's where it's slowly but surely coming together.
And that's an example of the array of policies that are already in play in Wales that you mentioned earlier, Claire, that provide the foundation. The whole becomes greater than the sum of the parts.
Yeah, so like the work that James has been doing on healthy working relationships is around the dignity at work and the grievance policy. And it's how do you have those difficult conversations within the workplace in a respectful way that does as little harm as possible, but resolves the issues as best that can be, because we're human beings and we're very complex and we're working in a very stressful environment, and things can become fraught. I think that's natural. And at the moment, things are difficult at home and they're difficult at work and they're difficult everywhere. And staff have been, living with this now and working with this for a year. So it's not surprising really that we are all now reaching the end of our human resources. It's getting to the point where we are depleted. So I think we need to just think about, I don't know, the sunshine, the birds, the flowers, spring, and just give ourselves all a break. Just be compassionate to yourself as much as to someone else.
Yeah,
it is
kind to yourself.
It is about compassion and self-care.
I heard that organisations are looking towards how they listen to their staff at this stage in the pandemic, so that they can help them to keep going, to recover, if you like, from the impact of the pandemic. Are there particular things that you've been able to highlight that would help with that?
So we've got a conference on the 21st of April, which is the first health and social care health and wellbeing conference, and that conference is all about providing a safe space for listening. So that is one of the things that we're doing. There are hubs across Wales in health boards. There are compassion circles. There are sports rounds. There's all sorts of different models around NHS Wales where you facilitate that kind of time, that safe space for staff to just offload and say how they're feeling. And a lot of the times they don't actually need any intervention. They just need a safe space to say how they're feeling. And that's what we're doing. I mean, in Swansea Bay, there's over 300, nearly 400 health and wellbeing champions. There's so much good work going on. I could talk all day about what the work the health boards are doing.
Yes, it's remarkable, isn't it? The scale of what's grown over the last year. Any thoughts on that, Nikki?
I would just agree. I think there's so many, just areas of good practice that, we're all working extremely hard to listen. I think it's the listening. And Claire mentioned about pausing and taking a breath. I think that needs to be done as well. I think there's we also need to consider, I think, when the first wave started to sort of reduce, it was almost back to business as usual as quickly as possible. I think we now need to take that second to say, what have we gone through? What have services gone through? What have individuals gone through? And give staff that time to reflect. And, for organisations to have a time to reflect, for managers, for services. So I think we do need that opportunity to reflect. And I'm not saying for, an extended period of time, but I just think we need to give people time just to think about what we've gone through before we start to push the business as usual. Because I think there's a danger that what will happen is we'll sort of go straight into the business as usual, and that will have a negative impact on individuals further down the line, which, people will at one point might just hit a wall and say, I can't do any more. So I think that's important. I think for me, if I talk about a specific thing in Cardiff and Vale, is that we recently in the organisation built the Surge Hospital on site, so the Lakeside Wing. And without having to ask, the plans included a staff haven. That's what we call it, a space for staff. So for me, my capital planning colleagues in Cardiff and Vale, without having to be sort of pushed or request, built that into the development of the Surge Hospital. So an area for staff to take a break and have a respite from the demands of, I'm not even going to say demands of work, because it's open 24/7. So someone, you know, before a shift, during a shift, or even after a shift can access that space. So it's just a new way of thinking. Before, space is at a premium. Everybody knows that. You know, every room cupboard has been turned into an office in hospitals, whereas all of a sudden we're starting to think outside the box and think about well-being. So that to me is, you know, it's those things that give me, you know, that energy and that hope that we're actually going to change this. We're going to turn, you know, just turn this on its head, and our whole way of working. It will take time, but some of it will get right, some of it will get wrong. But, you know, that was already in place without having to be asked. So I hope we don't lose that memory as well. You know, we need to learn these lessons and keep it and hold it.
Okay. I have a question about following on from that. We talked about how the learning in this area has, you know, relevance right across the public sector and beyond. Also thinking to within health, although we're talking primarily about staff experience here and the support that they need, many of the lessons perhaps apply to patients as well. The trend over the years has been for less space away from the bedside. More and more activity is focused there despite best efforts. I'm just wondering whether you think there's any possibility to address that trend, to identify the needs of patients in respect of their well-being as well.
I can only speak about Cardiff, and Claire will you know, have a wider view on this. We're already doing that in Cardiff. So we're already engaging, you know, with our service users, with our stakeholders, to look about how we shape our future services, with the aim of moving away from a hospital-based model and more taking care out into the community to where the individual needs it. So we've already started that. That's been launched just last week. So, you know, and I'm sure other health boards are doing that as well.
And what I would say about that, Phil, is that when services are being looked at, when any kind of change or any kind of improvement, what we need to look at is all those people involved in that change. So you've got the patient at the centre, but then you've got all the staff, the multidisciplinary team that comes around that patient to ensure that every single member that are coming in and coming out of that relationship, their health and well-being is looked at in advance. Because what we don't want to do is create services that are fit for patients, but then aren't fit for staff. We have to look at the whole picture.
How does that relate to what you see in terms of the way we look at services at the moment, perhaps in terms of developing clinical pathways that cut across the various sectors and domains of healthcare?
We've moved away from equality impact assessments to actually expand that to equality and health impact assessments. So health is now included. So, you know, when there's any service development or any changes, you know, health is already being considered for all the stakeholders in that.
There's also the management standards, the health HSC standards, which have a large part of that is around demand and control and autonomy and competence. So that needs to be part of the EQIA as well, so that you're looking at that impact on people. I think what we've noticed is the importance of social interaction with our patients as well, and how important recovery is with regards to having their family with them, and you know, the fact that they haven't been able to through COVID has had, you know, we've seen a direct correlation between the two. I mean, I had a procedure a few years back, and the thing I remember the most isn't the skill of the surgeon, but the lady that stood next to me holding my hand through it. You know, I can't underestimate how important it was that she was there holding my hand. And I think that was her only job, but that's the best job, you know. But it's so important, and absolutely, health has to be considered, not just, you know, the 9 protected characteristics. It has to go wider than that.
Just going to ask a specific question that kind of follows on from something we were talking about earlier. Obviously, some of the consequences of the pandemic for staff will be very long-lasting. It's been a traumatic experience, and no doubt those experiences, the consequences will play out over time. I'm just wondering what you think about that situation and what kinds of things that organisations might offer for their staff.
In some ways, we're still in unknown territory. We don't know what the long-term implications of this are going to be, because we're just coming to the end of, you know, probably the second wave, a big wave of the pandemic, and we don't know what the future is going to bring. So there might be further. What we do know is that the more waves we encounter, the longer term and the more significant the impact that's going to have, definitely psychologically. I know that, you know, from a psychological perspective in Cardiff and Vale, we're already increasing the resources that, you know, we've got for staff who are dealing with work-related trauma. So we're increasing that. We're also we're working with, you know, to promote health for Health Professional Wales, because they've got trauma support as well for staff. Again, each health board is working to develop COVID recovery pathways, and again, we're developing specific pathways for staff who are sort of recovering from long-term COVID as well. So we're developing those resources. But I think we're still in this watch and wait as to where we're going to go. And I think now that we're coming out of the second wave, I think that's when staff will be reflecting, and I think that's when perhaps we'll see an increase in the demand on the services that we've got. Because prior to that, staff just didn't have the time, the energy, the headspace to process this. So I think now some staff are going to be sitting back and thinking, what have I just gone through? Yeah. And that's where we're going to see, but who knows what the future is still going to bring. Hopefully the impact of the vaccines and the vaccination programme, we'll start to see the benefits of that as well. But I still think we're early days. We're early days in recovery.
I think we need to think about it in the same way as we think about new digital technology and new advances in medicine. So as the NHS adapts and advances to AI and new individual bespoke medicine with cancer, we need to do the same with staff health and wellbeing. We need to have the same approach, and that is a lot of what we don't know, and so therefore we have to have a real agile approach to it, so that when we become aware of it, like with any new research, right, well, what do we do about that now? Now that we know this, what do we do? And it's got to be an organic, living thing. It can't, and I think that's the most important thing. I know some countries that experience SARS and MERS. There is some information that we can use from them with regards to the impact on staff psychologically who were dealing with it. But I don't think they had a second wave like we did. I think so it is going to be very much, we have to use an agile approach and listen to our staff and see what other countries are doing.
On that note of final thoughts, anything that we haven't talked about that you think it would be helpful to mention?
We're not heroes, we're human.
Yeah, I think in the beginning of the pandemic, we were portrayed as superheroes, the NHS, and when I talk to staff, I actually say we're not superheroes. You know, when we get hit, if we get punched, we don't jump back up, we hurt, we bleed. So I don't actually think that being sort of compared to a superhero is actually relevant. So I think, you know, we just need to take that on board. We are human beings.
Yeah, you're right, Nikki. We bleed, we bruise.
Yeah.
And my soundbite would be to look after yourselves and look after each other.
And I think my soundbite would be talk to each other. Reach out. If you need help, ask for it. Don't suffer in silence. There's always someone there who can help.
Well, I'm very grateful to both of you. It's been a really interesting conversation today. Thank you very much for giving us your time.
Thank you.
Thank you.
Nikki.
Yeah.